What doesn't Medicare cover?
In general, Medicare covers most of your medical needs, everything from hospital care to doctor visits to tests to lab work. With a separate drug plan, the program covers prescription drugs. But Medicare doesn't cover everything.
What about vision, hearing, and dental?
Those are the big coverage gaps. For vision, original Medicare covers cataract surgery and only your first pair of glasses afterward. It doesn't pay for routine eye examinations, contacts, or regular glasses. Neither does your Medigap plan if you have one. As for hearing, original Medicare and supplemental plans currently don't cover routine hearing tests or hearing aids. And for dental, that's the third big gap in original Medicare. And it doesn't cover routine dental checkups or big-ticket items like dentures or root canals. Some Medicare Advantage plans, which are private insurance alternatives, do provide vision, hearing, and dental coverage, but be sure to check on exactly what they pay for. You can also buy standalone insurance policies for vision, hearing, and dental needs.
That's good to know. What if I'm outside the U.S.? Will Medicare cover me?
Original Medicare doesn't cover most healthcare outside the U.S. There are some narrow exceptions, such as if you live in the U.S. and need medical attention, but a foreign hospital is the closest medical facility. Some supplemental or Medigap policies and Medicare Advantage plans have limited coverage for medical costs incurred outside the U.S.
That's helpful to know. Are there any other major items that Medicare doesn't cover?
Medicare won't pay for some elective procedures, like cosmetic surgery. You're also on your own when it comes to routine foot care. One more thing, Medicare doesn't cover most long-term care. There is an exception. If you need rehab after a hospital stay for a stroke, broken hip, or other injury, Medicare will pay for inpatient physical and occupational therapy for 20 days. But if you become so frail or sick that you need round-the-clock residential nursing home care, Medicare doesn't cover that. To learn more, go to aarp.org/Medicare.